Yes, good morning wherever they watch us from. Like we talked some minutes ago, say, well, Health Matta go come your way with Dr. Bat Ofegbol. I'm the CEO, Grace Valley Medical Center. Vis-a-vis the theme of the moment, topic of the moment, the one we be saying in the whole world now they discuss that is coronavirus. We say we don't start some weeks ago. This week, Dr. Bat go help us do justice into that one. Well. So anywhere where you dey, call papa, papa call mama, mama call children, because this one get to do with everybody. Make we sit back, make we listen, make we for take ask any question on anything we know they vivid or lucid to us on this coronavirus. So permit me to welcome and also yield the floor to Dr. Bat. Good morning, sir.
Thank you, Chief.
How you dey, sir? Now from far now.
Our greeting
Now
pattern
from far now. Or we use the leg.
Yes, sir.
Over to you, sir.
Yeah. Good morning, viewers at home and around the world. We are happy to be back this morning. We'll be dealing with the topic we started some few weeks ago, coronavirus pandemic. Coronavirus pandemic. I would like to start by reading a message from a very well-known footballer that most of us will know, a passionate message to the whole world. He says, "The world is going through a very difficult moment which demands the utmost care and attention from all of us. I speak to you today not as a footballer, but as a son, father, a human being concerned with the latest developments that is affecting the whole world. It is important we all follow the advice of WHO, World Health Organization, and the governing bodies on how we handle this current situation. Protecting human life must come above any other interests. I would like to send my thoughts to everyone who has lost someone close to them. My solidarity to those who are fighting the virus, like my teammate, Daniele Rugani, and my continued support to the amazing health professionals putting their own lives at risk to help save others. Cristiano Ronaldo." This message, passionate message, was from Cristiano Ronaldo. The health workers that are putting their lives on the line, a good number of them have actually lost their lives in the course of trying to ensure that other people are able to stay alive or get cured in the course of doing their job. I want to also look at the current statistics of coronavirus as of today. As we speak, 145,857 individuals across the globe have been confirmed to have this disease. And so far, the death toll stands at 5,436. That's a far large number by every or any consideration. The number of people that have been able to recover from this scourge at the moment stands at 72,531. Let's look at the countries that are equally affected at this moment. As we speak, 145 countries and territories of the world have been affected and still counting. Top on the list, of course, is China. At the moment, they have total number of 80,824 people that have been confirmed to have this problem. And among this number, 3,189 of them did not survive. I would also like to point out that China, at the moment, are turning out and reporting almost the lowest of figures from the countries that are worst hit. Over the last 24 hours, the new cases in China stood at just 11. So they've done wonderfully well. Also along that line, South Korea, that was next to China some few weeks ago, are also beginning to report lower number of people that are affected. Those are positive signs coming from that area of the world. But not so for the whole of Europe. As we speak, the coronavirus has new epicenter, and of course, that is in Italy. In the last 24 hours, 250 people were said to have died in Italy alone. In the peak of the coronavirus in China, they never witnessed a death toll this high. That is a fact. 17,666 people have been affected, confirmed cases in Italy. And out of these, the number of deaths in Italy stands at 2,547 as we speak. And after Italy, you have Iran, okay, with 11,364 cases. New cases, 1,289. Total number of deaths in Iran, 514. The fourth on the list is actually South Korea, and they're beginning to report lower figures. And we can go on and on and on. I also would like to mention, because of the strategic place that U.S. occupy in the whole world, at the moment, the total number of cases in the U.S. is 2,513. In the last 24 hours, the new cases they've had in the U.S. is 816. Frightening, we want to say. And so far, U.S. has reported about 50 deaths. And of course, you and I know that African countries, a good number of African countries have been affected. As we speak, there are over 15 countries in Africa that have been affected. And of course, Nigeria is within this list. Thankfully, we have just 2 affectations. We have just only 2 people that are currently affected. In Nigeria also, I would like to also announce to us that those people who were kept in quarantine as a result of their contact with the index case, they have all been discharged, and of course, they've gone home. That's some good gist coming from Africa. Also, in Africa, I must also point out that Africa, for some reasons, a number of factors, maybe it may be traceable to a number of factors. African sub-region have been reporting very low figures, except countries in the northern part of Africa, like Egypt, that has over 80 cases at the moment. What could be responsible? A number of authorities have done some speculation. Does it have to do with our tropics? Does it have to do with our genetic makeup? We don't yet have scientific evidences along those lines, but I want to believe something is responsible. And also, I must also appreciate the tremendous work the Ministry of Health is doing. The tremendous work the Lagos State government is doing through the Lagos State Commissioner of Health, ably headed by the Lagos State Commissioner of Health, Professor Abayomi. Fantastic job there. I want to also commend the work of the journalists and everybody, paramedics, medics, who are involved in the fight against this scourge. Essentially is to keep us safe, to keep you and I safe. Permit me to also point out that one of the things that we need to guide against at a time like this, that the world is facing challenging times. The coronavirus pandemic is not just spreading, it's sweeping across nations, it's ravaging nations of the world. We should, as much as possible, avoid fake news. Okay? We can't stop fake news from being made, but we can at least stop sharing it. So says Nigeria Center for Disease and Control. We cannot stop fake news from being made, but we can at least stop sharing it. So you and I need to walk along that line.
E.g., drinking too much of they say ogogoro they cure am. I don't know if I'm right, sir.
You can go on and on and on. A good number of us can equally remember what happened some few years ago when we were faced with something similar, Ebola. A number of misinformation were out there that salt could actually cure it. And a lot of people went taking salt solution. And of course, we know what happened. Some of them didn't survive to tell their stories. So that is the reason why we need to avoid fake news. It's important we do so, because you can actually mislead people into doing the wrong thing. The reason why we are here today is to let you know those right informations that will help you and your family and the world over to stay safe from this scourge that is currently ravaging the world. Coronavirus, like we have said a number of times, is a large family of viruses that usually Predominantly, it affects animals, but a few of them affect humans, oftentimes causing mild to very severe diseases. Okay? Coronavirus has officially been named COVID-19. That is the disease. The disease itself is COVID-19. But the virus that is responsible for COVID-19 has been named SARS-CoV. SARS-CoV. That's the virus. SARS-CoV-2. That's the virus that causes COVID-19, which is the disease. Just like, similar to what you have, HIV is the virus that causes HIV/AIDS. Okay? So, COVID-19 is the disease, while SARS-CoV-2 is actually the virus that causes this disease. Permit me to also mention that some years ago, we actually saw something similar to coronavirus. That was in the year 2002-2003, also named SARS at that time, severe acute respiratory syndrome, that equally emanated from China, from civet cats, and affected quite a number of people, causing close to 800 or a little above 800 deaths in all. Next to that was the fact that we saw Middle East respiratory syndrome, MERS coronavirus, in the year 2012, that emanated from Arabian Peninsula, killing also a lot of people at that time. Coronavirus or COVID-19 is something similar to this group of viruses. How are they transmitted? What are the signs and symptoms? The major signs and symptoms, of course, are said to be, number one, top on the list is fever. Number two, dry cough. Number three, malaise and joint pains and body pains. Some other symptoms that one can equally present with range from runny nose to breathing difficulties, viral pneumonia, which of course does not have any cure. Okay? In some cases too, some people may present with diarrhea and a number of other symptoms. How is it transmitted? It's transmitted from one individual to the other. But originally, it emanated from a seafood market in China, in Wuhan, a city that is located in Hubei province. That was the origin of this COVID-19 disease. And of course, since then, we have been seeing person-to-person transmission across the globe. As we speak, the emphasis should not just be on policing our ports of entry. It needs to go beyond that because of the information that are currently available to us. The incubation period is said to be between 2 to 14 days. And we have also seen the concept of asymptomatic carrier. And that is the most worrisome aspect of this disease. In asymptomatic carriers, talk about people who may have the disease and yet they do not manifest any form of symptom. This group of individuals can actually evade all manner of check-ins that are done at the ports of entry. Because if they are not presenting with symptoms, there's no way you can identify them. And it is this group of people that when they go into the society and develop the symptoms, they will start manifesting all manner of symptoms and start infecting everybody around them. We all know what happened recently. The president of Brazil.
Is it the president
Yes.
or the...
No, the president of Brazil, okay, who traveled to the US with a number of delegates. Apparently, at the time they entered the US, none of them was manifesting any symptom. The president himself has been confirmed not to have coronavirus, just like it came out yesterday, early hours of yesterday, that Brazilian president was actually infected. Okay? He has also come out to say that his test came out negative. However, 3 of his delegates who visited the US with him were not so lucky. They've tested positive. And at the time they entered the US, apparently they had no form of symptoms. At the time they were leaving, probably that was the same picture. But a few days after, they are down. Here they are. And we also know a number of footballers too who have equally been affected. Okay? And we know today that a whole lot of drastic measures are being put in place to contain and limit this scourge or mitigate against the spread, ranging from closure of borders to flight restrictions and what have you.
Okay, Dr. Bat, we'll have to pause you a little bit there. Thank you very much for that lovely delivery of coronavirus. We'll actually go on this break. Immediately when we come from this break, we'll go open the phone line so that everybody go fit ask any question where they do their yaga as far as coronavirus they're concerned. Go nowhere. We will be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show where dey help people. Terms and conditions apply sha o.
In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold. And the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. Thousands more are fighting for their lives in hospitals. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. WHO has been in full response mode since we were notified of the first cases. And we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear.
Yes, you're welcome back. You just hear from the Director General for World Health Organization, Adron, as the name implies there. He don't talk about the coronavirus and the sensitivity of that word called global. He said, make we dey watchful on how we use what we call pandemic. Say something like global pandemic, let's be watchful on how we use those words. Anybody who listened to Dr. Bat a few minutes ago said he been warned us on the sensitivity and the kind of words to use, make we not spread fake news. Well, a quick recap into what he did. He made us realize that coronavirus, otherwise known as COVID-19, he said the virus will carry on SARS-CoV-2. He be make us realize, say China, we don't get over 80,000 plus as far as the statistics stands there. He made us realize that the coronavirus has made new epicenter in Europe, and specifically that is in Italy, where their own figure self they rise where. He said US, yes, we know US, they get nothing less than 2,513. But he said in the last few hours, say the number don't they increase, and over 50 death tolls now they've been get there. For Africa, make we come home, let us narrow it home. He said 50, over 15 countries in Africa, and then they suffer this scourge, where we call coronavirus, or you call it COVID-19, vis-a-vis. He has also showered encomiums on with Commissioner for Health, Lagos State. I'm talking about no other person but Professor Emmanuel Akin Abayomi, speaking of the kind of sensitivity and how they make sure say all ends they on deck. So what do we do now? The next thing to do now is to give you the opportunity. You can see the phone lines on your screen. Call in, reduce the volume, and ask anything we know they clear to you as far as coronavirus or COVID-19, as the name implies, they're concerned. I'd like to take the first shot while we await your call. Yes, doctor. A Nigerian got coronavirus and the Nigerian survived. What is the magic behind this? Medically now, let's speak medically now. What will be the magic where they behind this? Does this really mean that this disease no fit stay for black man body ni tabi now you know better, so what's the magic behind it?
Thank you very much, sir, for that very important question. I must also point out that you're not the first person who has asked this question. Oftentimes we get it from time to time. Now the truth of the matter is that there is no scientific evidence to actually allude to the fact that the genetic makeup of the black man can actually resist this coronavirus disease. However, there are some school of thoughts that believe that because of the nature, the climatic condition of the tropics, the disease may not actually thrive. Going back to the second question, talking about the Nigerian who must have survived. We have Sunday from Benue. Sunday, good morning.
Good morning, Sunday.
Hey, good morning.
How are you doing, sir?
I'm fine.
Yes, our doctor is here. Go ahead with your question or contribution.
Yes.
Go ahead, Sunday.
Good morning, sir.
Yeah, good morning, sir. We are with you.
I'm fine. I'm fine.
You need to turn down the volume on your TV set so that we'll go enjoy ourselves, please. Okay, please, for subsequent callers, first thing, make we reduce the volume so that the echo no go to disturb the communication. Okay, over to you.
Yeah,
sir.
thank you. Talking about the people who have survived, not just in Nigeria, currently, the global statistics, 72,531 individuals have survived from this COVID-19 disease or pandemic. Okay? 80% of people that may be afflicted or that may pick up this infection may actually not go to the hospital. With or without treatment, they can recover over a period of time.
Are you saying it's self-limiting?
Yes, like a good number of viral infections, sometimes they can be self-limiting. So 80% of people who pick up the infection may not come down with the disease.
Sorry, let's take
from
Abiodun.
Oyo.
Abiodun, how are you doing? Good morning, Abiodun.
Hello, good morning.
Good morning, sir. Where in Oyo? Are you calling from Ibadan?
Ibadan.
Have you seen our PEFT Institute in Ibadan at Mokola? Yeah? Abiodun, you need to go check it out too. We are live in Mokola, Ibadan.
Coca-Cola Sango Cemetery area.
Yes, you're on point. You're on point. So tell your friends, may not go register. April 1, we they begin lecture. So go ahead with your question.
Okay, I just want to ask the doctor, does what he's saying now, does it mean that we Africans, we should not be panic or we should not be afraid that the virus cannot survive within us?
Thank you very much. That's not what I'm saying, but I'm also saying part of what you said. That word, panic, we shouldn't panic for any reason. What we need to do is to take measures that can keep us protected. And of course, we are going to reel them out, read out some of the things we expect that Africans, not just Africans, everybody should be doing to stay protected. Okay? Now, beyond not panicking, okay, there are a number of things that is expected of us as individuals, not just what the government can do. Okay? I'm going to talk about some of them shortly. Number one, we need to imbibe the culture of keeping and maintaining good personal hygiene. Equally important is community hygiene. We must ensure that our environment is kept clean at all times. We must develop the habit of having good hand hygiene, meaning that we must wash our hands plenty of times during the day, depending on how you move about. In situations where washing hand must be done under running water with soap, not a tablet soap, soap that can be dispensed by just putting your hand under the soap container. Okay? In a situation where you can't do that, you can equally use alcohol-based sanitizers, which are easily available in Nigeria today. In situation, you probably may be in a vehicle traveling from one place to the other, you should have hand sanitizer on your hand. Some other things that we need to do is to disinfect surfaces around us, because what you need to pick up this infection is by being exposed to aerosol or droplets that could come from an infected individual when such a person sneezes into the air or coughs into the air. We've also been advised, if you have cough, you must at least learn to cover your mouth when you cough with a tissue. In a situation where you don't have, you can cough into a bent elbow, sneeze and cough into a bent elbow. We must also keep good distance from one another, especially if you have somebody who is presenting with some of the symptoms we have mentioned. Social distancing is important. We must avoid as much as possible crowded places. These are some of the practical ways that we need to. Oftentimes too, some of the things that we handle most often during our daily activities is our phones. Have you ever thought of that? Have you ever wondered? Those phones that we handle can get infected. Oftentimes, this happens often in the hospital. You could have a patient who wants you to probably speak to a relation of his. He said, "Doctor, take my phone." We should stop that. It's not healthy.
But doctor, let me quickly cut in. Two questions at a go.
Yeah, thank you very much,
One,
sir.
the issue of tissue and handkerchief. A lot of medical this thing went on social media on that. So please, I want you to demystify. Is it true we should do more of tissue than hanky? Then number two is, when you talk about phone, how about currency, money? We all touch money.
Yes,
they no go give me money.
We're coming to that. Okay. At the peak of this pandemic in China, in Wuhan, they started sterilizing some of their currencies. A good number of them were destroyed. What they were doing at that time is that some currencies will be taken out of circulation. They will take it to a center where they will sterilize it and keep it for 14 days before returning it. In some situations, they will outrightly destroy the currencies. I'm talking about the currency notes. Wow. Those were some of the measures that they took, and today you can see they are reporting lower figures. As a matter of fact, Italy and some other countries of the world are beginning to import Chinese medics to come and teach them how to fight this coronavirus, because they've demonstrated that they've been able to contain a good number of those makeshift hospitals that they built, some of them that they built within a space of 10 days. Christopher from Lagos, good morning.
Christopher. Good morning, Christopher.
All right.
How are you doing?
Yeah, good morning, sir.
Good morning. Our doctor is here.
I'm good. I'm very good. Yes, sir. What the doctor said, I am really happy, because wrong information kills. And a lot of us, especially Nigerians today, we are capitalizing on passing wrong information. This one says, especially look at the social media today. When you go to the Facebook, you see a lot of things. This one, I was alerted on 3 days back that Lagos and those states, over 100 people have been infected with coronavirus. I was like, is God going to allow Nigerians to be wiped away just like that? But surprisingly, when I heard this morning that it just 2 people, I was like, wow. So, like the doctor said this morning, information cannot stop, but we should maintain that standard. Don't move. Don't say what you don't know. Don't say what you don't know. You must be sure of yourself first. So, the doctor, I'm very, very happy. Once again, good morning again.
Good morning. Thumbs up. You spoke my mind.
I don't know. Thank Nigerians because you have been praying already. And I want to encourage us again that we should not stop praying to God. Yes. Because if we want to do it ourselves, we can't do it. We can't do it at all. In that case, it's only God that can help us. Because to me, I don't know, although people do criticize this country a lot, like we don't have facility, we don't have this, we are down, we are low. If we want to do it, a lot of people might have gone before the solution. Thank you very much.
Thank you very much. Thank you very much,
Thank
Mr.
you
Christopher.
very much. Sir, let me quickly chip this in. Mr. Biodun that called from Ibadan. Well, you mentioned our address offhand and you got it right. So you have a gift from us. On Monday, please just walk down to PFT Film Institute, 32 Coca-Cola Road, Mokola in Ibadan. Just come down in the morning or afternoon. Anyways, just come in, ask of me, then you have a gift from PFT Film Institute. We are proud of you. Thank you very much. Then another question I would like to quickly ask, Doctor, before you dwell on the fake information. Another information that is going on, circulating on social media. Somebody even showed me this one yesterday. And I don't even know how to convince the person that no, the issue of boiling of garlic. Say, once you boil garlic and you drink it or you chew it very well, in fact, nothing like a coronavirus, garlic, they got it from a World Health. I don't know, sir, garlic, boiling of garlic, the water.
Thank you very much. We can't shy away from the fact that these things exist. I'm also on a number of platforms, okay, where we see a whole lot of fake news. What I usually do is that when you post anything unsubstantiated, not only will I target fake news, I will also do a fact check of what you have posted. And oftentimes when we do it, those people will quickly go in and delete their messages. That is what we are saying. Nigeria Center for Disease and Control says, yes, we cannot stop fake news from being made, but we can stop sharing it. That's the only way we can help to fight fake news. Because at a time like this, what we need is the right information. I was talking about how we can sterilize some of the things we use, disinfect the surfaces around us. Because if you have an infected person coughing and sneezing, it could be in the lift, it could be in an ATM that dispenses cash.
Gallery.
Okay, so if such a person sneezes on top, by the time you touch the buttons and probably touch your nose, you're as good as infected. Look at the mayor of Miami in the US. He had a handshake with one of the delegates that came all the way from Brazil. And today he has tested positive. Just a handshake for somebody who wasn't presenting with symptoms. It is that simple. I was talking a while ago about how we can disinfect some of the things, the objects that we use from day to day. Top on the list is our handsets, okay? I was thinking, with my little knowledge of science, that the best way to go about it would be probably to clean with methylated spirit. But I saw a documentary on BBC yesterday where a microbiologist was actually saying that the best way to go about it is to get a soap and a clean handkerchief, soak it with water, and then squeeze out the water and then gently wipe your phone. This should be done repeatedly on a number of times every day, okay? Think of having to go to an ATM to probably take some cash, and the person who probably got there before you or who made withdrawal must have sneezed and, of course, contaminated the whole environment. And there you are, punching the buttons with your bare hands. At the end of the day, you end up touching your mouth and your nose. So we should avoid touching our hands, our eyes, and our noses. Though not very simple to do, but we can develop it.
Doctor, sir, let me quickly ask this again. In times like this, is it too much to say we should wear gloves? Possibly. What you want
a lot of people have actually advocated that. A lot of people have actually advocated that. But the fear there is that we're avoiding supporting such facts for some reasons.
Why
okay,
so?
Look at face mask now. Not just in Nigeria, the shelves are dry. People are finding it difficult getting face masks, okay, that ordinarily should be used rightfully. I'm not saying there are ways to use face mask rightly, but not for everybody to be using. We have Mohammed from Zamfara. We'll come back to your question, sir.
Okay, sir. Mohammed, good morning.
Okay, good morning. How is it?
We are fine. Yes, our doctor is here. Go ahead with your question, please.
Of course, right. I am so much interested in the question raised by Chief Olododo.
Okay. I'm with you, sir.
Okay. I say I'm so much interested in the question raised by Mr. Olododo.
Which question, sir?
The question about whether the virus is specific to Black Africans.
Okay.
Whether the resistance is specific to Black Africans.
Thank you very much. I will try to answer the question once more. Okay, thank you very much, Mr. Mohammed. Now, the truth of the matter is that I think that piece of information or news started when a Cameroonian student picked up the infection in Wuhan in the heat of the epidemic, okay, before, of course, it became pandemic, okay, in China, and he was able to get cured. So he posed for some photographs with some of the doctors that treated him, and it was all over the place, okay. I must also point out that I saw the information, and I also shared it on my social media platform. I shared it on Facebook, and I'll tell you what happened. I asked a question. Could this be true? I needed some other people to put information along that line, that the genetic makeup of blacks can actually resist this scourge. Okay. Within a space of 1 week, they did a fact check on my post, and of course they blocked it. They said fact checked, untrue, cannot be substantiated, but they still left it there. I didn't delete it. Of course, I could have deleted it because a number of people shared it when I shared it. Okay, so I wanted them, and I want to believe it was done so on their different accounts. Okay, so that is what is going on now. Any information that cannot be substantiated, cannot be backed up, okay, you need to do an extra fact-checking before you can actually start spreading the information. There is no scientific evidence that the genetic makeup of blacks can actually resist the infection, coronavirus infection, so to say. But it is believed that the disease may not thrive as much as it does in temperate regions of the world, places that are cold, okay? In the tropics. That may be why we have lower number of figures in sub-Saharan Africa. As we speak today, Egypt has 93. As of 2 Thursdays ago, they had only 3 cases, okay? 2 foreigners and 1 Egyptian national. But today they have 93 cases.
Speaking of Egypt, sir,
Yes.
which is in North Africa, the
Yes.
question I'd like to ask again. Some people believe that this disease has to do with skin texture. They feel that, well, as Africans, our skins are thicker.
Race, yes.
But
Human race.
They adduce it to skin this time. And you know, a lot we see on this platform, they believe that our skin is thicker.
There is no scientific evidence to back up that side. There is no scientific evidence to back up that. And I want to believe researchers will soon come up with some specific information on some of these unsubstantiated claims that we have been seeing on a daily basis.
Are we debunking garlic boiling too, sir?
As we speak, coronavirus does not have any cure. All that can be done in the hospital, in intensive care units, all that can be done are supportive care. You give such people who are sick supportive care. And I also want to point out that if you're an elderly person, if you're in the age bracket of 60 and above, you need to limit your movement. You need to limit your travel. If you must travel to any part of the world, you actually need to do some studies because this set of people are vulnerable. Ditto for people who have pre-existing diseases like hypertension, diabetes, and heart conditions, as well as cancers. It's on that note that we'll be drawing the curtain today. We'll see you again next week. Thank you for being with us.
Okay, thank you very much. On that, we'll say thank you. Stay tuned next week. Dr. Bat will definitely continue on this because it is the rave of the moment.